name is Angie Hill. I'm a DNP student at Southern Adventist University. Today I'm going to be presenting a micro teaching module on trach suctioning. This is pre-conference for Skills Lab at University of Memphis, Lowenberg College of Nursing for first semester nursing students. I have already distributed the skills competency checkoff list to the students, and so we'll go ahead with our module and objectives. The objectives for this module are to introduce the students to tracheostomy suctioning, the procedure, to verbalize and demonstrate the procedure according to their skills checkoff list, and then to supervise their practice of this procedure after we do the presentation. So, the first thing we need to do when we're going to trach suction is we need to gather our supplies. The supplies included are your stethoscope, pulse oximeter, sterile water, and the suction kit. So just like any other patient interaction, the first thing we're going to do is we're going to knock on our door. Hello, walk in, introduce. Hi, I'm Angie. I'm your nurse today. I'm going to take a listen to you and see if we need to suction your trach. Then you need to get by two patient identifiers, identify your patient. Can you give me your name and date of birth, please? Yes, Rolane Green, date of birth 2/2/22. Good. So now Miss Green needs to, as I sanitize my hand, put up in the semi-Fowler's position. Semi-Fowler's is between 30 and 45 degrees. And there we are. Okay, so to get ready to suction Miss Green, the first thing we want to do is hyperoxygenate her. She's on 2 liters. We're going to go ahead and reach over to her oxygen and turn it to 4 liters because we don't want her to desat during this process. The next thing we're going to do is put the pulse oximeter on her finger so we get what she is satting now. All this time, we're listening and looking for indications that Miss Green may need to be suctioned. These things might include cyanosis or blue tinge around the lips. Maybe she's restless. Maybe she's got an altered mental status. Maybe she's using her accessory muscles or retracting when she's breathing, or have an elevated respiratory rate. Maybe we can just hear what's going on in her chest and can tell that she's junky and needs to be suctioned. But we're going to also listen. We want to listen to all of the lung fields that we can get to. That's going to be anterior and lateral, and posterior. Posterior may not always be possible, but again, you always want to listen to every field that you can get to so that you have a full assessment of where your patient's problems are. And we're going to put her hair back on. Okay, so yes, Miss Green sounds pretty junky, and we do need to suction her. In order to suction, the first thing we need to do before we go sterile, because this is a sterile procedure, is we want to take this snap off the collar, because we can't touch that with sterile hands, leaving the oxygen on the collar. Okay, so you're going to sanitize your hands, put on a clean glove, turn on your suction to between 100 and 150 and test that suction. Okay, so we have good suction. I'm going to discard that glove and sanitize. Now we're going to set up the materials that we're going to use to actually do her suctioning. We're going to open our kit. This kit has inside of it the container for the sterile water that we're going to pop open and just set right down. the sterile gloves. Not all kits come with sterile gloves. If it doesn't come with sterile gloves, you need to make sure you get your gloves before you go about doing this. And it's always a good idea to have 2 pairs of sterile gloves just in case you contaminate, all right? Then you take your sterile water, you pour it into your sterile container, and you make sure that the rim of the bottle does not touch the edge of that container. Okay, looking at our O2 sat. Miss Green is satting 88%, so we need to get this done. So at this point, we're going to don our sterile gloves. And when you're putting on your sterile gloves, if they get a little funny when you're putting them on, don't let that frustrate you. Just, you're sterile to sterile, so just work them out. There you go. I always have the habit of when I go sterile, I close my hands. That just helps me remember not to be touching anything, okay? So, we've got our sterile gloves on, and now we're going to get out our catheter, our suction catheter. Anytime you're going to pull a catheter out of any packaging, always make sure that you have a really good control over that catheter. They're loose. They can flop all over the place, and you don't want them to do that. So you take them out carefully, keep it coiled in whichever one of your hands is going to stay sterile. In this case, I'm going to have my left hand sterile and my right hand dirty, because with this hand I'm now going to pick up my suction tubing and I'm going to connect my catheter to my tubing. Alright, so far so good. And like I said, it's a good idea to keep that coil in there just because it helps you to maintain control. So we're going to test our catheter, make sure we're patent. Alright, good. That also kind of lubricates the tip of that catheter. Now, we can only suction for 15 seconds at a time, and you want 30 seconds of oxygen between each suctioning. Most cases you're not going to be suctioning for a whole long time, but you do want to make sure that they get plenty of oxygen between each suctioning. So, dirty hand, we're going to move the oxygen, and then sterile hand, we're going to go in about 5 inches, okay? So you go 5 inches in. If you go too far, your patient is going to be coughing, coughing, coughing all over you. And then as you withdraw the catheter, this is where you're going to kind of use a circular motion. And there we go. Okay? Immediately, that dirty hand puts that oxygen back on the patient. And then we clear the catheter, making sure again that we stay sterile on that left hand and that left side. Okay, 30 seconds. She's still kind of sounding junky and having a hard time. Dirty hand moves the collar. Sterile hand inserts the tubing. About 5 inches, and then kind of a circular motion as we pull that out. And immediately get that oxygen back on that patient. Okay? So now we're done with our sterile part. We can go ahead and reach over, turn off our suction, replace that tubing, and take those sterile gloves off. So now what are we doing? Now we're reassessing our patient to see if our suctioning has been effective, right? Okay, our O2 sat down here on her finger has come up to 96%. Right there, that's a really good indicator. If she was blue before, is she still blue? No, she's not blue. If we could hear her without the stethoscope before, can we still hear her breathing and hear the junk? Okay, if not, great. If she was using those accessory muscles or had retractions before, does she still? Is her cognition kind of coming around? Is she kind of clearing up? So you have to note what is actually going on with the patient, assessing them to see if your intervention has been successful. And then you need to document. So what do you need to document? Well, always patient tolerance, right? Miss Green tolerated this procedure well. We need to know what you got out, meaning color and consistency and amount. Amount is not necessarily going to be an exact amount. You're not going to be able to say you got out 5 milliliters of secretions, okay? So your amount is going to be either scant or moderate or copious, right? So I got out a moderate amount, and we need to name the color. Was it clear? Was it white? Was it yellow, green, brown, blood tinged, or bloody? Those are all things that you can see come out in secretions. So we have a moderate amount of yellow secretions. Well, what else about them? Are they thin? Are they thick? Or are they really sticky, which is tenacious? Okay? So Miss Green, we got out a moderate amount of yellow, thick secretions, and she tolerated it well. That is our pre-conference for our suctioning module, and so now you guys are going to get to practice on your own, and I'll be around. Thank you very much.